Ladies and gentlemen, please welcome our APHA President, Joyce Gaufin.
Okay, we'll do a sound check. Does that sound okay? Okay, great. Well, it is so wonderful to be here with the public health family. You're like all extended siblings, and it is just my delight to be here today. I'm going to work without a net today, and we're going to see how things operate. So, throughout the year, I've attended many public health meetings. I feel like I'm one of the most educated people in public health. I've seen so many scientific sessions, I couldn't even keep track. I'm glad I didn't have to fill out CE forms on those sessions. Let me start by saying thank you to my friends and my family who are here today, and to the APHA staff who has provided incredible support throughout the year. No one can get to a position like this without the support of many individuals. And I've been fortunate in my career to have many mentors, many supporters who helped me get to this position. I don't think this is a record, but I have visited 29 of our affiliate organizations. Thank you. I've visited 4 countries over the last little while. I've attended many meetings with students. This has been one of the most enjoyable experiences that I've had this year. We've had career development workshops, we've had a lot of breakfasts, lunches, and dinners, and I just want to say that the students gave me enough energy for this journey. I did something a little different this year. I said I wanted to do workshops and do special seminars with some of our affiliates to try to strengthen and help them become more sustainable organizations. And I've done over 2 dozen of those. I've traveled about 180,000 miles to get here in the last year and a half. And I've spoken, I calculated, to about 10,000 people, but I've never spoken to so many people at one time before. So I'm trying to get into this. I covered the entire map. I started my journey in Indianapolis, Indiana. And the 4th visit that I made was to the state of Louisiana. And I am proud to say that I am a card-carrying member of the Louisiana Public Health Association. I've been from Hawaii to New Hampshire. I've been from Alaska down to South Carolina and Southern California, and it has been an incredible journey. One of the things that I've spoken about as I've talked to people is the importance of global health equity. And I think that this quotation sums up so well something that brings us all together. There are certainly values that we have that integrate and are so deep and concentrated that they impact everyone. Our most basic common link is that we all inhabit this planet. We all breathe the same air, we all cherish our children's future, and we are all mortal. U.S. President John F. Kennedy. I'm going to give you a few slides that will set the case and provide a context for talking about the APHA strategic vision of creating the healthiest nation in one generation. Many of you are familiar with the January 2013 report from the Institute of Medicine, where it compared U.S. data against 16 peer-developed countries. And in this, we were number 17 out of 17. Okay, I think we have a little ways to go. They specifically cited the fact that the United States is lagging behind other countries in life expectancy and health, and they expressed the gravity of the situation. They specifically cited social and economic conditions in the United States that impact where we stand. There are fewer programs for safety nets that buffer the negative effects of health and poverty and other social disadvantages. And they talked about the higher levels of poverty, especially among children in the United States. And they talked about the expanding discrepancy between the tops and the bottoms in our country. There's another study that was conducted by CDC and Kaiser Permanente in San Diego called the ACE report, which talks about adverse childhood experiences and the impact of these experiences on children as they get older, the kinds of health outcomes that they will have, and actually a shortened lifetime. These are extremely important for us to consider as we talk about creating the healthiest nation in one generation. A recent report said that the United States ranked 26th out of 29 OECD countries in 2010. And they talked about the ranking with 6.1 deaths per 1,000 births. But some of our countries, especially in southeastern United States, had death rates that were far higher than this. There can be no keener revelation of a society's soul than the way in which it treats its children, from Nelson Mandela. And I think that so many people in our country just imagine that all children who grow up in the United States are in the slide, live a life like the slide on your left. And I know that that is not true. My own personal life experience told me that this is absolutely not true. So I'm going to give you a little teaser. I'm going to tell you that I grew up in a family in Utah with 60 siblings. 60 siblings, and I know what you're thinking. But you're probably wrong, and I'll tell you the rest of the story in a minute. To create the healthiest nation in one generation, that is an incredible challenge, and that's going to take a lot of work. So what I'd like to do is focus a little bit on what I think we need to do to help advance this. And I want to talk about it from an organizational perspective, from a societal perspective, and I want to talk about it at the individual level just as well. I often think when we talk to people about health in our country, people mostly see the U.S. system as the top part of the iceberg. That's the part that they can see. They see all of the real benefits, the good hospitals. They think that a lot of people, everybody that I've talked to so far believes that anyone in our country who really needs health care can get that. Anybody, if you're really sick, you just go to a hospital and they will have to take care of you. Where I come from in southern Utah, every week our newspapers are filled with people who are holding bake sales and car washes to try to finance some family's health care because someone was in an accident or they found out that their son or daughter has brain cancer and they weren't part of our system. They were not included in health care coverage. I don't want a bake sale society for health care in the United States. I want health care for all. Thank you. When we are in public health, we live, breathe, and eat social determinants of public health. And if you ever talk to someone and they just get a glazed look over their face like, what on earth are you speaking about? We do this so often, I think that we've actually immunized ourselves to the point that we don't understand the reactions that other people have when we talk like this. What we really need is a social movement that changes the way that our society values children. This is going to require new partnerships and more effective collaboration. And one of the things that we're going to need to do is a better job of communicating with other people. The recent Ebola situation has been a prime example to me of how important it is for us to get our messages out and stay ahead of the game. I think we missed opportunities with the Patient Protection and Affordable Care Act. Patient protection was an important part of the Affordable Care Act. I think we've missed opportunities with Ebola in terms of staying on top of things. We need to listen to other people because we need to learn from our opponents. They have an opportunity to develop powerful language. When the NRA speaks about freedom and liberty and personal responsibility, they are using powerful terms. I was happy to hear when I was in Georgia this year that our Center for Disease Control Director, Dr. Frieden, talked about how the value of public health is that we give people good information they can use so that they can freely make a choice in how they can make their families healthier. I think we need to start developing powerful language. Everyone must become an advocate. You know, studies have said that we could have up to 450,000 people in our country who are somehow engaged in public health. Imagine if we could have all 450,000 people feel comfortable, open and free to be able to speak about the value of public health. So many people, like me, worked in the public sector or a nonprofit sector where they felt restrained and restricted from their ability to speak up about public health. Can you imagine a world where educators didn't talk about the value of education? I can't imagine a better group of people in the world to speak to elected officials about public health than the people right here in this room today. And when we talk to people, we talk about data, we talk about statistics, we talk about population health. But people do not fall in love with a population. They fall in love with individuals, they can fall in love with a family, maybe their neighborhood, but they don't fall in love with a population. We need to use language and stories and examples that illustrate the outcomes and the impact down to that individual level. It makes a difference when we talk in that terminology. One of my favorite and most inspirational people is Dr. Donald Berwick, who directed the Center for Medicare and Medicaid Services and who has been involved in quality in health and public health for so many years. And in a speech that he made not this last January, but the year before, he talked about a number of challenges that we have that are great, that are not specific to public health, but they impact us. One is the lack of confidence in science. And this is absolutely rampant in our country. And it just drives me insane to think that a former playmate has more influence over people thinking about vaccine safety and efficacy than the Surgeon General of the United States. And when we have a potential disease outbreak that could be of the scale and the scope of Ebola, and they would rather listen to a politician than to listen to the Surgeon General or to the director of CDC, we have a problem. These are people who generate fear and not facts. We have to learn to talk to people in a way where we are friendly and encourage them to talk about these fears and about how we can help them overcome the fears through evidence-based policies and programs. He also spoke about defending the poor is not popular in our country. I think it just became less popular last week. There was a wise man from Minnesota who once said, "The moral test of a government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the seniors, and those who are in the shadows of life, the sick, the needy, and the disabled." That person was Hubert Horatio Humphrey. Wouldn't it be wonderful to have a person like that speaking out again? Don Berwick also reminds us to talk about the miracle of prevention. And we had a return on investment theme for Public Health Week just recently. And this is another thing that we need to learn to speak about, not just in lots of dollars, but the impact on the families. And he challenged us to name the excess spending in healthcare, because if we could spend our way out of a problem, we should be the healthiest nation. All of this is going to require leadership. You may have noticed in all of my articles this year, that word came up over and over again. The Institute of Medicine report on the future of public health said, "Today the need for leadership is too great to leave its emergence to chance." And as I've spoken to people throughout the year, I've said to them, you know, how many of you know truly great leaders? And very often people say, I really don't know anyone in my realm who is a truly great and inspirational leader. And what I have found over the years is that a lot of people in public health and other areas are promoted because they were the most senior individual, they were the most technically expert individual. In other words, it was their turn to be the leader of the group. And when you talk to these leaders, they might say something like, "I like everything about being the leader except for the people. If I just didn't have to work with these people, I would be able to do a really good job." We need to have leaders who have a different set of skills. I've reduced this down to 3 key areas that I think are essential to effective leadership. First and foremost, the importance of relationships, then creating a shared vision, and having passion with a purpose. The importance of relationships is the most fundamental thing in our lives. From the moment you are born, you start forming relationships with people. If we can't form relationships that are built on trust and respect and mutuality, we will never be able to succeed in the work that we need to do. Absolutely essential. And many people don't even know the impact that they have on others because they don't seek feedback about their skills as a leader. This is one of the most important things you can do as you want to advance yourself as a leader. Find out and seek feedback about how other people see you as a leader. The Healthiest Nation in One Generation is a big vision. And when Dr. Benjamin first brought this forward to the board, I think a lot of us just sat there in awe, imagining that we were going to participate in something so noble and so big and such a challenge. We need to have a vision to keep us directed because having a clear vision helps move people forward. And that is the work of a leader. Leaders must transform. Leaders don't just manage. They take people to places that they have never been before. We need leaders who have creativity and innovation and imagination. And yet most of us work in organizations that have very little of this. They don't encourage this. They don't train us in this, and they don't value it. I know when I worked in a state health department, we were not encouraged to be innovative. We were not encouraged to take many risks. And if we got our names on the front page of the paper, it better be because we did something really good. You have to engage other people in the process. Where I come from in Utah, Stephen Covey is the late Stephen Covey is a noted leadership authority. And he said that we must first seek to understand before we can be understood. These are skills we must have. About a year and a half ago, my daughters and I went to Disneyland, and we had a little time, and we went into the theater there and saw the schematic map that Walt Disney had drawn about this place that was going to be the happiest place on earth. And as we looked at that, I thought to myself, how do you translate that into something that is real and tangible and lasting? Disney developed a group of people whose job title is Imagineer. Imagineer. Wouldn't you like to be a public health Imagineer? I would like to be a public health Imagineer. A leader needs to be able to tell a story that helps people understand where they're going to go and what's in it for them. And if you can't give me that, then I'm probably not going to go on the journey. So as we're thinking about creating the healthiest nation in one generation, we need to have a collection of really good stories. You also need to have passion for your work, passion with a purpose. So I would ask you to think for just a moment, reflect on that time when you first knew that public health is where you wanted to be. You wanted to be a part of this family. I remember when I realized that public health was where I wanted to be. I'm a non-traditional person in public health. I started as a typist in a typing pool in a state health department, paying the bills for public health. The reason that I am in public health is because of the family I grew up in. I only had one father and one mother, and I had 60 siblings. I had one brother who was my permanent brother, and the rest of these were foster children who lived with us, sometimes from a few days to 3.5 years or more. And one thing they had in common is all of these children came from difficult situations. We would say their social determinants of health were extremely poor. On the ACE study, we would say that they had multiple adverse childhood events. What I learned from these children is that with support, with training, with nurturing, most of the parents loved their children to pieces. They simply didn't know how to be effective parents, or they didn't have a safety net that could help them so that they could feed their children healthy food. They knew how to find a place where they could live in a safe environment. They didn't have these resources. One child came to our family under a 72-hour protective notice. His mother lived with a boyfriend, and the boyfriend had developed a unique way of disciplining the child for wetting the bed. He burned the child on his leg with his cigarette. And when he came to us, he had bandages down his leg. This child was released back to the mother, who probably went back to live with the boyfriend, in 72 hours. Our society didn't protect him. He would be about 55 or 56 years of age now. And I have to wonder, what was his life like? People would ask my parents, why do you do this kind of work? How can you embrace these children and love these children and make them a part of your family and then let them go, not really knowing what they're going back to? And they had a simple answer. We do it because we hope we make a difference. And isn't that why you do public health? I know what it's like to really do public health. I've done it for 41 years. So often we feel like we're beating our head against a brick wall, and we spend more time putting out fires than we can anything else in this world. It's a challenge, but we do this because we think we're making a difference. And we know in the work that we do, you can't expect outcome changes in a year or two. It takes a generation sometimes. Nurture your passion and link it to a purpose. When things are really rough and tough, and when you think you're not winning the fight, you cannot win a social movement without having the passion. And I truly believe that public health is represented so well by this particular quote. A small group of thoughtful people could change the world. Indeed, it's the only thing that ever has. We may be strong, but we are mighty. Now I want to talk about the kinds of leaders that we need for the future. Again, we need leaders who have creativity. So you need to be practicing your creativity, and if you are the leader of other leaders, you need to help people have an opportunity to practice this creativity. We need to have leaders who have courage to do the job. I can only imagine what it must have felt like to be the director of CDC and be so criticized with every turn and know that you were doing the right thing all along. Finally, we need people who have resilience. I've developed really good resilience traveling around the world this year. And I think that, again, the passion that I got from the students and the people that I visited, that kept me going. You fed me in many ways. And you really nurtured my soul throughout the process. But because our work is so difficult, and because the challenges are so great, and because we get tired of beating our head against the wall, we need to train ourselves for a marathon, and we need to not think of ourselves as being in a sprint. Heifetz and Lewinsky, in their book, The Practice of Adaptive Leadership, say that we need to really think long range. I'm not a marathon runner, but they say, marathon runners, look at the goal. It's 26 miles away. We have a famous marathon that goes right by my house in southern Utah. And every year I look at those people and I think they're absolutely crazy, and I wish I could join them and do that. They are focused on a long-range goal. And we have to remember that our work isn't just the fighting fires every day. So I want to close by showing you some beautiful travel photos from Zion National Park, which is only an hour away from our front doorstep. Some of you may recognize this monument. Some of you may have hiked up to the top of this. This is called Angel's Landing. It's 1,800 feet high, and at the top, it's only 6 feet wide as you go up the spine. Many people have a goal to climb to the top of Angel's Landing. And as they get up to Scout's Lookout, they see that there's something more they're going to have to do. They're focused on this long-range goal, and now they're taking a look at this spine where they've actually drilled holes in the sandstone and put chains there to help people pull themselves up and to keep from falling off of the edge. Some people turn around at Scout's Landing because this is too much of a challenge. But others forge ahead. They see the challenge and they move forward. When they get a little bit further, they're at a point where no longer are they looking at the long-range goal. They are literally now walking step by step by step. They've lost range of the vision. They've lost range of the goal. And this is what happens in our work so often day to day. We get tied down in the routine, we put out the fires, and we get tired, and we forget what we're working for. But what I can tell you is that if you make it to the top, the view is spectacular, and you remember why you went through this journey. I thank you for letting me be part of a journey in public health. And I want to come back to where I was at the very beginning and thank you all because you are the part of public health. Thank you. Thank you. Don't make me cry right before I have to introduce our next guest. You do that for me. It's my great honor to introduce the Acting Surgeon General of the United States, Rear Admiral Boris Lushniak. Admiral Lushniak was introduced to the United States Public Health Service in 1983 as a senior medical student and began his career in the Public Health Service in 1988 as a lieutenant. He joined the Centers for Disease Control and Prevention in the Office of the National Institute for Occupational Safety and Health, where he conducted epidemiological investigations of workplace hazards. During his time at CDC, he was part of a disaster response team that operated in Bangladesh, Russia, Kosovo, and he was part of the CDC NIOSH team at Ground Zero, and also part of the CDC team investigating the anthrax attacks in Washington, D.C. In 2004, he joined the Food and Drug Administration as the Chief Medical Officer of the Office of Counterterrorism and was appointed FDA Assistant Commissioner in 2005. While at FDA, he was deployed after Hurricane Katrina to serve as the Department of Health and Human Services representative in San Antonio. Dr. Lushniak joined APHA in a September symposium on bringing together public health and private sectors to combat tobacco's devastation on health, and he has been an outspoken champion on educating Americans about skin cancer prevention. Dr. Lushniak has dedicated his life to improving the health of others, and we are delighted he is here with us today. Ladies and gentlemen, I present to you America's top doc, Dr. Boris Lushniak.